Are you on TRT and having increasing levels of hematocrit? Maybe you're having to donate blood all the time and worried about the impact of this high hematocrit on your health. My name is Dr. TERRANELLA, and in this video, we're going to look at some of the things that go into rising hematocrit levels and what you can do to manage that and lower that risk of elevated hematocrit. So again, my name is Dr. TERRANELLA, and if you're new to this channel, I just want you to know that I'm making these videos to help you go beyond the basics of your health. Whether it's a confusing lab test, symptom, or diagnosis, I make these videos to help you get a better understanding of what's going on with your health. So if you like this kind of information on nutrition, hormones, health optimization, genetics, etc., click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information in this video is for informational purposes only. It's not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deeper your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. All right, let's look at how to lower hematocrit while you're on TRT. So in this video, we're going to talk about how to lower hematocrit while you're on TRT. TRT, if you don't know, is also known as testosterone replacement therapy, and it's a very effective treatment for treating men with low testosterone. With this treatment, there's oftentimes improvement in symptoms such as fatigue, libido issues, erectile issues, and sometimes issues with mood too, like depression, anxiety. Problem is, it can also lead to elevations or rising levels of red blood cells and corresponding hematocrit. So what is hematocrit? So hematocrit is the percentage of red blood cells in a given volume of blood. And it's the percentage of red blood cells as compared to the percentage of the clear fluid or the watery part of your blood. So typically the percentage of red blood cells is going to be less than the percentage of the watery fluid. So less than 50% would be red blood cells. That's kind of a rough range to shoot for in terms of the hematocrit is less than 50% or right around 50% when you're on TRT. High levels of hematocrit or increased amounts of red blood cells can increase the risk for things like blood clot and potentially other problems. The reason that it could potentially increase the risk for blood clot is because there's less fluidity there, so things are moving slower. You can think of it like cement. If you keep cement moving, it can never actually solidify. Same thing with blood. As there's more particles or more red blood cells and other things in the blood that slows down movement, then potentially is when you can get a actual clot. So this is why if you're on TRT, it's important to monitor your hematocrit levels and correct elevated levels or make sure you're staying in a somewhat optimal range. So when we're looking at this question, how to lower hematocrit levels while you're on TRT, we want to look at what's actually causing the increased production of red blood cells or hematocrit. So there's a couple things to think about with this. So we know that testosterone stimulates the production of EPO, also known as erythropoietin. And this molecule or hormone stimulates the bone marrow to make more red blood cells. We also know that DHT or dihydrotestosterone is like 10 times as strong as actual testosterone. This is true for much of the functionality of testosterone versus DHT. So I believe that part of what is triggering some people to have higher hematocrit levels when they're on TRT versus others is a increased level of DHT or dihydrotestosterone. And so that may be playing a larger role in what's triggering your high hematocrit levels. Now, DHT is also responsible for much of the benefits of testosterone replacement therapy or TRT as well. So we wouldn't want to take the DHT number down to zero. But with this in mind, we can look at how you could potentially lower your hematocrit while you're on TRT. The first obvious thing to look at in terms of how to lower your hematocrit while you're on TRT is to potentially adjust your dose. So this isn't really me saying you should adjust your dose if you have high hematocrit, but you should talk to your doctor to see what the appropriate steps should be for you. There is a critical point or threshold at which the testosterone replacement therapy and the corresponding DHT is not going to stimulate your bone marrow as much. As you make those adjustments, it's important to continue to monitor the hematocrit, red blood cells, and other things to really see what the rate of change or the rate of increased hematocrit is doing. So instead of it going up by 5 points every month, maybe it goes down to going up by 4 points or 3 points every month. You also have to make sure you're checking at the same interval every time in relation to your blood donations. If you are doing blood donations, checking at a certain time interval before the blood donation or after the blood donation is going to be important. So you're comparing apples to apples as you make these adjustments to your dose of testosterone. The dose adjustment that you make is going to be dependent on how high your hematocrit levels are and how high your testosterone and DHT levels are. All these things are going to be helpful in making that decision. It's not a one size fits all kind of thing. So you do have to kind of customize it to your own body and what's going on with your hematocrit levels. There's a wide variation in what happens with changes in hematocrit you're on TRT. Another thing to think about in how to lower your hematocrit while you're on TRT is your hydration levels. So since your hematocrit is a percentage of the red blood cell to liquid part of your blood, making sure you're well hydrated is important, because if you're not well hydrated, well, that blood part is going to go up and the liquid part's going to go down. This is particularly important when you're going in for a blood test, but I mean, you should always be staying well hydrated. And this is more important when you're exercising or doing things outdoors when it's extremely hot out. One of the most effective ways to lower your hematocrit when you're on testosterone replacement therapy is to donate blood. The blood donation will reduce the amount of red blood cells in the volume of fluid. And this is perfectly fine and reasonable to do, especially if you're only needing to do it 2 or 3 times a year. It's probably even actually healthy for your body to get rid of some of the older proteins and older cells. If you have to do it every 2 months or sometimes even more, it can cause problems with low iron and plasma proteins if you have to do it, again, like on a regular basis. The other thing that comes to mind in this question of how to lower hematocrit while you're on TRT is the actual size of the red blood cells. So this is measured by something known as the MCV. And the larger the red blood cells, the more volume those red blood cells are going to take up. If you have 3 small ones, they may not take up a whole lot of volume, but 3 large ones are going to take up much more. So that's pretty intuitive. So the MCV is referred to as the mean corpuscular volume. Corpuscle is a red blood cell, and that's oftentimes mostly going to be influenced by B12 and folate. Alcohol and the amount of red blood cell turnover also influences this. This is a fairly big topic to stuff into this video here, but the size of the red blood cells is very important in managing your hematocrit. And you want to keep it on the lower side, like somewhere around 90. And so if it's much higher than that, it could have to do with alcohol intake, B12, folate, and potentially other things. So overall, in looking at how to lower hematocrit while you're on TRT, there's a few different options that we have. Of course, hydration is really important. Adjusting your dose of testosterone so that the DHT and actual free testosterone aren't so high. The size of the red blood cells is also important. And being careful to monitor any changes as you make adjustments to any of these things. That's just going to give you more leverage on keeping that consistent over time. As you make those changes, that X worked and Y did not work. As always, it's important to talk to your prescribing doctor about all these things regarding lowering hematocrit while you're on TRT. They're going to have the best context on what's going to be the best thing for your particular situation. And there is going to be a lot of variation from one person to the next. Taking some of these steps can definitely help you lower your hematocrit while you're on TRT and minimize any potential risks and maximize the benefits. Okay, how did I do? Did that help you better understand how to lower your hematocrit while you're on TRT? Hopefully it did. If you do have follow-up questions on this topic, drop it in the comment section. I'm happy to answer your questions. I may do a separate video on that topic. Thanks again for watching. We'll see you next time.